Hello everyone, I am Dr. Rajni. Today I am going to talk about mental health concerns and COVID patients. I thought of sharing few things with you, being a mental health practitioner who has dealt many psychiatric problems among COVID patients. Mental health of a COVID patient is as important as the physical health. Why it is that important? As a part of treatment, patient needs to be in isolation and quarantine. Many of them have reported that isolation is the biggest problem. Recognizing that you have been tested positive or worrying about getting infected puts you under a lot of stress. When you feel more stressed, you may lose your sleep, appetite, you may feel sad or anxious, you may get nightmares, you may have headaches and a stomach upset. Concern or fear for death is also a major concern. You may be thinking that what will happen to the family if you die, or how the children would cope up in that situation. All these thoughts make you feel even more stressed, make you to feel sad or anxious. If that happens, it will decrease your immunity and the symptoms will get worsened. Let us look at what a patient needs to be done to improve their mental health. Many of these suggestions are applicable to mild to moderate level of symptoms. You could choose, you could do whatever you can. Depends on the severity of your symptoms. Firstly, the most important thing is that to focus on your mental health and physical health. That is the utmost priority right now when you are in COVID situation. Connect with the others emotionally and mentally, even if you are isolated physically. Talk to your friends and significant others through phone, WhatsApp, and emails. Emotional support is very important. Many patients have reported that they felt more distressed than getting infected with the COVID when they realized that the significant others were neglecting them emotionally. So it is very important that the family members, dear ones, are giving more support to the patient. So keep the patient more closer to your heart. Otherwise also, we need to show more concern when others are in distress. Immerse yourself in activities which makes you feel happy, especially when you are in isolation at home. Immerse yourself in hobbies like reading, writing, drawing, painting, and such things. You can also do simple breathing exercises. For example, Anuloma Viloma in yoga. You can also do simple exercises, breathing exercises. Inhale, hold your breath for 1 or 2 seconds, then exhale. This you can do 5 times, 10 times intermittently, and you can do it when you are walking, sitting, when you are resting. You can also try meditation as well. Engage yourself in small exercises as much as you can do. Even if you are walking 10 minutes in your room can make you feel better. Many studies in different countries have shown that people become more spiritually inclined or may develop more faith in God when they get affected with the COVID. It enables them to cope up with the situation much more better way. It is good to have hopes in God principles or any beliefs and seek courage from it. Do not hate yourself or others for being affected with the COVID. Put aside all your negative emotions like anger, sadness, or frustration. It is important to have a positive attitude overall. You need to tell yourself that I will survive COVID and face the situation, face the disease with courage and calmness. Seek counseling if you are feeling more distressed, sad, or anxious. If necessary, take medicine as prescribed by your doctor. Follow the instructions of health professionals. It is mandatory to take nutritious food which will boost your immunity. Avoid alcohol and smoking completely. If you drink or smoke during COVID time, it will affect your symptoms very worse. Let me say one more thing before concluding. It is not only for the patients in isolation or those who are in quarantine needs emotional support, the caretakers too. The family members and significant others goes through various emotions like fear, sad, or despair. Family members should encourage each other and support each other. Don't criticize the caretaker, don't blame them. Then only they will have the mindset to take care of the patient in a much better way. We are all fighting against COVID, so be supportive to each other, be safe, be courageous. This time also will pass. Please subscribe to my channel for more videos. Thank you.